Can I?
Wow.
A senator proposed that all the Congress people were to go on the public option, the Democrats voted it down. If this is gonna work, why wouldn't they take the public option? That's so great.
Well, the president has said that the public option wouldn't be what I have as president or what you have in Congress. There are different levels. Are any of you on FSU's health insurance policy?
Yes, I am.
Yeah. You know how there's different levels? How you have the comprehensive and the basic?
Yes, I do.
Well, the public option is a basic plan so that people can go to see their doctor and they can get coverage when they need it. It's not a full-on system that is, if you want the best coverage, you can stick with the private system. If you like the system you have, you can go to the private system. But if you need care, you can go to the public option when everybody else
So we're saying
So we're sacrificing quality.
Do you think the private systems don't offer basic packages as well?
They have basic packages, but there's also the problem with deniability of pre-existing
Deniability.
conditions.
Do you know how many people are denied? Based on
There's about 47 million right now. Every day. 30 million.
18 million of those people choose not to have. No, what we're talking about right now is people with pre-existing conditions who are denied health insurance coverage. Do you know exactly how widespread that problem is?
I don't know the exact number for the pre-existing.
Okay,
It's not 47 million.
Exactly.
The president says it's
No,
30.
exactly. You don't know how big the problem is, so of course you're going to have a big way to address it. You don't streamline
You're saying we don't need a big plan.
Absolutely, I'm saying we don't need a big plan. Why do you think that in order to get anything done, you need a 1,000-page plan that nobody even reads?
So hold on, we're crazy for not supporting an 8,000-page bill that none of our senators have read.
Is it 1,000?
This is a lot.
8,000?
Which bill? Which bill? Excuse me. I was picking on one bill. Also, again, with regards to competition, if you insert someone into the market that is going to slowly put the insurance companies out of business, they're already in the red, many of them. The idea isn't that, oh, if I don't like the government insurance, I could go to this other company. Not to mention, some of the bills, if you're unemployed or however it works out and you don't have insurance for a time, they fine you. You are fined for not having health insurance on some of these very dubious bills. Not to mention the fact that the idea is that once the government starts slowly draining these insurance companies, what are we going to do? Bail them out? Or are they going to go under? Either way, the only option left will be the public option. Have you been to Thagard? Have you been to the DMV?
That's a completely different situation.
It's a government run.
It's a government, it's a public run, terrible, bureaucratic, slow, inefficient system. There is no way.
Why would the public option run out private? The private
I'm not going to go
insurance
to
companies. Wait, 1 second. We have FedEx, we have UPS, we have the United Postal.
How's the Postal Service doing?
I'd like you to listen to his example, please.
Why would that?
We're going to say it all over again so they can all.
Oh, come on.
Why hasn't the government run out private businesses such as UPS?
Because they have a legalized monopoly over non-emergency stamped mail. And they can't even do that. They have to contract out to FedEx and UPS.
This is why we made concessions to the insurance companies. So
Now you're in the pockets of a corporation.
And the government will not run the private systems out of place because, look, the private systems in the mail industry work fine. You know, there's no reason that the public option is going to be the only one left. They're scare tactics.
Scare tactics. The people chanting that there's so many people dying. Apparently there's 47 million people with cancer that can't get into the ER today. I don't think. But we're the fear mongers. This is astounding.
Okay, can we? I know we haven't asked a question in a while, but can we get?
Yeah,
public options
baby.
not in the plan?